Welcome to Biomed Unleashed.
Our podcast is endorsed by the MERLN Institute for Technology-Inspired Regenerative Medicine
and supervised by Professor Lorenzo Moroni.
We aim to make regenerative medicine accessible and understandable to everyone.
In our episodes, we invite scientists, specialists, and innovators to share their career insights and latest discoveries in this exciting field of regenerative medicine.
Today, we're happy to welcome one of the most influential figures in regenerative medicine, Professor Clemens van Blitterswijk, a Dutch tissue engineer, entrepreneur, and investor. He has revolutionized the field of biomaterials, particularly through his pioneering work in osteoinductive materials for bone regeneration. Clemens van Blitterswijk is a full professor at Maastricht University and founder of the MERLN Institute for Technology-Inspired Regenerative Medicine. He has done an outstanding work in academia, biotech, and entrepreneurship, from founding RegMed XB and leading Kuros Biosciences to co-establishing one of the largest life sciences funds in Europe. Clemens is the most frequently cited Dutch material scientist who filed more than 100 patents and won numerous national and international awards. We're thrilled to speak with him today about innovation, leadership, and the future of regenerative medicine. Let's dive in. Hello, Professor Clemens van Blitterswijk. It's such an honor to have you today as our guest. Thank you very much for joining.
Pleasure to be here. Thank you for the invitation.
Thank you. The first question that we would like to start with is actually with your background. We know that you studied at Leiden University for your bachelor and also you did your PhD there. And then you did your PhD on ceramic implants for middle ear, right? Can you please share with us what actually sparked your interest in regenerative medicine?
Yeah, it's an interesting question because regenerative medicine was not in existence at that time. Actually, nobody had thought about the concept. So even tissue engineering did not exist, and the field of biomaterials had just started. And what sparked my interest, that was to get a job. Because in the early 80s, and we're talking about 82 now for my PhD thesis, 80% of the biologists, and I was a biologist, or still am a biologist, were still unemployed 1 year after graduation. So there was no situation that you could choose what you were going to do. Actually, I was also a tennis coach at that time, and I had decided I would be a part-time tennis coach to raise finance, and then the other time I would spend on doing a PhD thesis. That's what I had done. And then I met my wife-to-be, and suddenly I realized, well, being a tennis coach might not be the best way to get a certain income. I should start to apply for jobs. And well, actually, I saw this single advertisement, and I applied for it, and I got it, which was quite special at the time. But again, these days it's very different times, because you can indeed select where you would like to go. But at that time, you just needed to get a job. So that was my main interest. How I got the job is also at least I still find it kind of interesting, because I had seen the advertisement, but if you want to get a job, you need to prepare yourself. And somehow I got access to the grant, which was part of that particular job. So I could read through the grant, and because of that I was extremely well prepared, and also very worried actually, because I looked at the grant and I thought, how on earth are you going to write a PhD thesis on that? It seemed a little bit poor to me, but in the end it worked out quite well. Yeah.
Wow, and you also met your mentors, right? Professor in biomaterials, was that at that time?
Yeah, actually I had three supervisors. So the first one was Jan Grote. He was the professor of ear, nose and throat surgery, so that's where I did my job application. I had Klaas de Groot, who of course is most well known, unfortunately deceased last year, but yeah, really a giant in the field of biomaterials and especially in ceramics. And then I had a professor of electron microscopy, Daams, who was also guiding me. So those were the three people guiding me. yeah, it was a very different time, you know, and with this podcast, I don't know who's listening, I don't want to bore you too much with stories of the past, but if you walk in this institute, you see all the instruments, you see the funds available. When I started my lab, there was nothing, really nothing. I had a room in the attic without any equipment and a budget of 10,000 guilders, which is currently about 4,000 euros. To start the entire lab. So I needed to go borrow equipment. I had incubators in the attic for histology, and actually the temperature in the attic could be so high that I could switch off the incubators. And you would be there totally alone. So I still sometimes have the idea that this situation is so completely different. On the other hand, I should also say the good thing is that you can build it yourself, because you build it off scratch. You also have the full responsibility, and that of course is again advantageous. Yeah.
But then you say that you were more into research, setting up your lab, right? But you also founded companies, your companies at that time.
That was later, yeah. So the first challenge was to build the lab. Mm-hmm. And that was not easy in that period. So first we built it to about, I don't know, we had 6 people or so, and then in the Netherlands, like it's happening now also, but it happens everywhere in the world, you have these cycles in research funding. So sometimes it's really good, sometimes it's bad. So after a couple of years, it started to be really hard to raise funds. And I had to think about my career. And at that moment I got a job offering at the University of Heidelberg to start a company. And I was one of the few in the world who was able to culture human skin at that time. That was when the tissue engineering was starting. So my guess would be at that time there were no more than 10 people in the world who could actually do that. I was one of them, and they wanted me to start a spin-off over there. And actually it was kind of interesting, so I went to Heidelberg, they wanted to have me. But I drove back to the Netherlands and I thought, yeah, you know, now I'm going to start a company for other people. Why would I do that? It's probably much better if you want to start a company to do that by yourself. They wanted to have me nevertheless, so we actually entered into salary negotiations, and I just asked such a ridiculously high salary, I thought they were never going to do it. But actually they more or less did that. But still I decided not to do it. And then my professors, mostly Klaas de Groot and Jan Groot, they were quite smart, because they told me, look, you should go to Germany, talk to those guys. We want you to have a good look at your opportunities. But then I came back and then they told me, shall we start a company together? So that was also a really good means to keep me. And actually at that time we started 2 companies. So I started one on electron microscopy and one on composite implant materials with Jan Groot and Klaas de Groot. And frankly, the fact that I rejected that job opportunity helped me very much, because this personal story, I worked at the university hospital as a biologist, and in the university hospital at that time, and still, you obviously have a lot of physicians, and the physicians all made more money than I did. And we had this weekly meeting, and then I would look around and I would see some smart people, but also some people who were not that smart, but still making more money than I did, which frustrated me a bit. But after I rejected the job offering at a good salary in Germany, that didn't bother me anymore, because I knew what my worth was. I'd rejected it. But at that time, that was the start of the first businesses next to the research. And I think that characterized my entire career. I like to do both. I wouldn't want to miss anything of it, neither the research, neither the application of the research.
But how do you manage to combine these both worlds? Because they're different, right?
Up to some extent they are different, but there are also a lot of similarities. Also, a scientist needs to be able to sell his research. If you cannot sell your research, if you don't have those skills, it's very hard to raise finance. And in starting a company, that's almost the same. A major difference is, I think, that as a scientist, Well, if you, from the spectrum going from white to black, the average scientist is somewhere in the middle. It's gray. We will never say, oh, it will absolutely be like that, or it's not like that at all. When starting a company, you cannot afford to do that. So in the company, it really needs to be totally positive. It cannot fail, and it will be a success when you start to raise finances. So that's, there you need to be able to switch. But most scales are quite similar, I guess. Yeah, companies are also faster. So in research, usually you don't need to make a decision standardly, so you don't need to make an immediate decision. Usually you can take half a year or a year even. In a company, it's sometimes an hour. Yeah. So then, but that also helps in research if you have those skills.
Indeed. So when you were very young, as for example, like in bachelor, so you didn't think at all about combining science and entrepreneurship, or it was already somewhere in the back of your mind and then it just...
No, not really. If I now look back, I realized that quite a lot of my family or ancestors, they were active in business, but I didn't realize that much actually when I... And also I don't come from a family where everybody studied, or actually nobody studied, so my parents, they were very nice parents, but mostly middle class. So I had no idea what it would mean when I would start to study. And frankly, I got into the biology, but even that was not really a deliberate choice. At that time, there was numerous fixes for biology. So I think it was about 50% chance that you would get in biology. And the number might be wrong, but at least you were not certain you could get in. I also thought it would be interesting to design buildings or bridges, so I also applied for that. And then I thought, well, let fate decide if I'm going to do biology or the other subject. And I got into biology, and that's how that started. So yeah, it's also driven by coincidence, I guess.
That's interesting. So basically, when you were a child, I would say you didn't think at all that you were going to...
Well, that's different. When I was a child, a young boy, I was interested in science, yeah.
Okay.
So, and in biology as well. So I would have lots of books on biology. I would also have a chemistry box and that type of stuff. So I was certainly, I would just say, an exploratory child. So the scientific interest was absolutely there. But I was not raised in an environment where that was part of the normal living, which of course for my children was completely different. They get it for free, so to say. And for me it was a world that I just did not know, which, by the way, are usually the most interesting worlds, those you don't know.
Yeah. And now if we go a bit further, then you worked at the University of Twente.
Later,
Yes.
yeah. So first I was in Leiden. Well, it's interesting. I think most people have the sense that they have their lives more or less under control. And like we currently see with the current political developments, that is an illusion, it's not true. And I experienced that too, so we were building quite a nice lab in Leiden actually. I think at that time we were the largest biomaterials group in the world, producing, if I'm not mistaken, 5% of the total scientific output in the world, all in Leiden. So we were doing great, and then the university decided that they could cut back on our budget, and actually that was my job. So I was in to become a full professor at that time, and suddenly my position was disappearing within a year time frame. And I found that very, very hard, because I'd been working so hard, and the reward I got from my university was that they took away my job. Interestingly, a decade later ago, they wanted me back as a full professor, which was okay, but I didn't do it. But the good thing of that cutting back in budget is that both Klaas and I were so very, very angry, because it was so totally unjustified, that we decided we would go away. We didn't want to stay anymore. And we did something which nobody had done before, and I think this is the early 90s of the previous century. We entered into discussions with the university to privatize the entire laboratory. So we made a deal. The university would continue to finance us for, I think, another 2 years. And then we took the obligation to try to get a job for everybody working in the lab in a privatized setting. And we succeeded, so I think that was 92. And well, I'm not entirely sure. But within 4 years, we had started Isotus, and Isotus grew in a 4-year period to, I think, 120 people, and it raised 100 million euros, which at that time was really a serious lot of money. And for a while, it was also the largest tissue engineering company in the world, actually. Yeah. So it shows you that what you think is a bad thing, so that was that people took away my job, in the end was a blessing in disguise, because it forced us to build something new, which was really a serious business. Of course, we could do it because we had already started 2 companies before, or 3 actually, so we had the skills to do it more or less.
But with such falls, when they just take your job away from you,
Yeah.
how did you keep going? What advice would you give to people who are struggling in the same position right now, for example? What was that kept you, holding to your...
Well, in this case, it was partially not even having a choice, because the job was just going. And I sometimes say half jokingly, hate is a tremendous motivator. So I was so incredibly angry. Actually, I also made a decision. We're going to build a company, but it's going to be far away from Leiden University at that time. By the way, my relation with Leiden University is really good now. No problem whatsoever. But at that moment, I was so angry. And that gives you a huge amount of energy. And that was also true for class. And then in the end, it turned into a tremendous adventure. My general advice always would be for any researcher, try to be independent from your direct environment. Especially if it's a large institute, because people in general you can trust. Of course, not everybody, but in general, people, is my experience, are really okay, can be trusted. Institutes cannot be trusted. So institutes will make decisions independent on the individuals they work with. So when you work for an institute, ideally you must be able to take your baggage with you to another spot, which actually we have done several times. It's not easy, so that I think that takes courage. It also means that you need to build the structure in a certain way. But it also makes your life very interesting. Yeah. So if I look back at my career now, I think the most interesting moments were those moments which you had not foreseen, where you needed to make a decision and have the courage to start something new.
Yeah, they're pivotal moments of your life, right?
Yeah.
And then if we talk about leaving universities,
Yeah.
you then in 2014 already left Twente University and came to Maastricht.
Yeah.
Why Maastricht?
Well, that's also a story. So we had built a beautiful lab, and what actually happened is it started with, I was chief executive officer of Isotus for a while, this great adventure, taking it public. But at a certain moment you need to make a decision. So I always had quite a large group of PhD students, still even in the company. But I had very little time available for the actual research. So when I would go to a conference, I would fly in, be there for a single day, and then fly out again. And that means that you are you're abusing your scientific knowledge. It's because your scientific knowledge comes from reading the literature, but it also comes from the interactions with your colleagues, especially at conferences. So that was getting less and less. And I realized I need to make a choice now. So either I'm going to be a career chief executive officer, of which I probably had the skills, but that means I need to stop doing the real science, or I need to go back to academia and stop at being a career chief executive. So I really thought about that, and I decided to go into research. And the major reason was that if we discussed comparing companies with a research lab. With a research lab, you make plans for 5 years or 10 years, and it can be really high risk. So you can really try something which nobody has done before. In a company it cannot be done, because in a company people will ask you, when are we going to make money? And if that is not within the coming 5 years, they are not going to give you the money or allow you to spend the money. So I decided that is what I wanted to pursue. So I wanted to be at the frontier of science, continue to be at the frontier, and also work with very more younger people. So it's not in the university, you always work with young people, PhD students. In a company that can be different. So that's when I decided that I would step back as Chief Executive Officer and go into academia, which frankly was quite exciting, because I didn't know if I would also be equally successful in raising the funds for doing the research in that new academic environment. Well, it turned out to go quite well. So quite quickly we had again about 60 people, and then MIRA, the institute, grew to 300 people.
Yeah, it's back in 20, right?
That was 20. Yeah, so this is the 20 story. So that was the third organization that I built actually. And then I was very happy at Twente, I should say. I liked it very much. At that time it was called the Entrepreneurial University, so every scientist could spend 1 day a week on entrepreneurial activities. It was small, it was very direct. Researchers had their total budget under control, so all funds coming in were under control of the professor, but you also needed to pay all staff, you need to pay rent for your labs, but you could make decisions, so I like that very much. But at a certain moment they changed, so they started to take money from the most wealthiest and successful labs and give it to the poorer labs. And I thought that would be very detrimental to our lab. At first I tried to convince the university not to do it. First they said, okay, we're not going to do it. And then they forgot about that half a year later. And then I sent them a mail, we are leaving. Or actually I am leaving, because I decided I would go. And then I told our staff, look, I'm going. I have nothing else, or I really had nothing else. I just didn't want it like that. And I told them I would try to find something else. If you want to join, great. And if you don't want to join, it's a pity, but I understand, because it was not your decision. And then I needed to find something else for the lab. Coincidentally, I had discussions with Maastricht University at that time, because the University of Twente could not accommodate all of my excellent staff members to become a full professor. So I had Jan de Boer, Pamela and Lorenzo at the same time. And I thought, yeah, I need to start a pilot lab at another university, and then we can move the staff there. So I had discussions with Maastricht, with the chairman of the board, 2 weeks after I made that decision. So we had actually a meeting here in Chateau near Cannes, a luxurious restaurant in Maastricht. And I told him, well, the situation has changed. And Martin Paul immediately jumped on the occasion. And I think a couple of months later, we had decided that the entire lab would move. It was like a soccer transfer. And then Leiden also called, by the way, and tried to call and get me back, but I already had made an agreement with Maastricht University. What was appealing about it, apart from the financing, which was really great, was also the setting with Brightlands, with DSM, which at that time was still really a materials-driven company. And yeah, it turned out to be an excellent choice, with about 150 people working in MERLN. But that's how that happened. So that was also an example of, at a certain moment, deciding that your current environment is not going to work. And the lab, yeah, we could move the lab up to some extent. I don't want to give the wrong impression, so it's not like when I don't agree with the situation in which I'm working, I automatically move. First I try to change the situation. So I also in Twente I put a lot of effort in convincing the university board on not doing this, because I really thought it would be really detrimental to this university, which at that time was developing as an excellent research university, a small excellent research university. And I thought what they were doing would strongly damage that. Well, I don't know if that was correct or not, but at least our decision to come here was the good one.
Yeah, because it's also called mega transfer when you transfer your research group from Twente to Maastricht. I've read that it's called mega transfer because there were 16 people of you. Yeah. There were 16 people of you, and then as you said, so you built a MERLN Institute for Technology-Inspired Regenerative Medicine here, where we are right now. And right now, I don't know how many people, but again,
I think it's 150.
150 people. So it has been 10, 11 years since
Within
then.
4 years, we had over 100.
Wow.
And we are now sitting in this office, so that's also a nice story, because we moved, I don't know if the rest is a nice story, but that is a nice story. When we moved here, well, you have seen the rest of this building. I think it's a pretty depressing building. You have these very long corridors, all closed doors, nobody sees his neighbor. So for scientific interaction, and certainly in a multidisciplinary group, that's a killer. So we told them, look, we want to move here, but you need to give us a facility which allows interaction between these different disciplines. People need to be able to speak all languages, so to say, almost literally. And we came up with this plan. And that took a lot of effort, because it was so, first the answer was, well, we can make windows in the doors. And we said, well, that's not going to do it. So they built this facility, and when we came here, we had 16 people. And I looked at this space, I thought, how on earth are we going to fill this? But in 3 years it was too small already. Yeah. So again, it showed it was a good thing to change. Now you say you moved, but I would like to emphasize it's always a team.
Yeah.
So it's never me alone, not at all. Yeah. It's always the people which work together. And I think we have always been very, very fortunate to have a quite talented group of people together who share the same vision. And that's how that works. Yeah.
So you said that, if we talk about MERLN again, you said that the people here really needed to speak also different languages and in direct sense, because there are also like 30 different countries where people come from, so they're it's very diverse, but also talking about this like freedom that you have here, because it's a big space, everyone is, I think, always talking with each other. But how did you keep it still structured, you know?
Yeah, in general, that's a challenge, because to keep something structured and manageable also is depending on the size of group. So typically, if you have, in my experience, if you have a group of about 10 people, it's pretty straightforward. Right? It's like we are sitting at this table now, it's easy to build a team, to share a vision. And in my experience, with about a dozen or 10 people, people also volunteer to do a job. So something needs to be done, somebody will step up and say, I'll do the job. Now, if you go beyond that to about 40 people, that doesn't happen anymore. So if you have 40 people, people don't volunteer anymore, at least, or it's always the same individual or the same small group. So that's why I already quite early decided if I have a group of about 40 people, I will split it up into 4 groups of 10. And if it's 120, it should be about 12 groups of 10, which I think you have with MERLN now. You have all the labs, you have 5 labs, and then there are 3, and then they are subdivided into the other units again. And that keeps it manageable. And I think it's very important to have people share the same vision. So it should be a very strong vision. But probably in science, to motivate people, it's best that people have the idea that they're doing their own thing. And so a scientist should be motivated to do his own topic. And frankly, I found that always very easy. So it's very easy to motivate people on that, because they are already motivated, and they're motivated when they come in. And I think it's very important to give them lots and lots of freedom. And for me it's easy to do, because I want to have that freedom as well. So it's very easy to understand that other people want that as well. So, and it's also the school where I come from. So the school of Klaas de Groot, my supervisor, most important supervisor, he was also very easy in delegating. So if you want to do it, go ahead, do it. If it's a success, you have done it. And if it goes wrong, people can come to me and complain. And I think that works very, very well. Yeah.
But if you still, for example, give freedom to all people in your group,
Yeah.
how do you keep this shared sense of purpose? You know, because it may be so different what they want to do, what they feel to do.
Yeah, that can be, with MERLN that can already be a challenge, I guess, because so big and you have different subjects. But it can also be different goals. So if you look at Isolis, we really had this goal to grow living bone. We were one of the first in the world to come up with that concept, so that was tissue engineering on bone. And everybody believed in it. So it was actually surprisingly easy to motivate people. Actually, it worried me sometimes how everybody would think along the same lines, because it's also dangerous. If everybody believes in something, they're not critical anymore. And you should remain critical, especially in science. So you will always have doubt. Does it really work? Can it work? Do all the data support my hypothesis? And if they do not, might I be mistaken? Now, that's very important. But that was relatively easy. Here, for me, the two drivers in this institute should be to do what nobody has done before. I think that should be the big driver. So don't repeat what others have done. I don't say that that's not useful. You know, research that repeats what others have done is important, but I don't think we want to do that. So it should be totally new. And we want to be really good at it. For me, that has been a motivator over the last few years, apart from the fact that we wanted to help patients. Of course, that's a major driver. But thinking about it, those are probably the three main components. If that is shared by everybody in the same way, I'm not sure, because if you come in as a PhD student, would you really care about the entire goal of MERLN? I'm not sure. You're probably more worried if you're going to write a PhD thesis that is successful or not. But these are the tools that we used. Yeah.
And then you said help patients at the end.
Yeah.
But for that, you probably need real companies or spin-offs to really bring it to application to the market so that patients can buy and use.
There are two ways to do it, of course. One is to license it out to a bigger company, or you do it yourself. I think in our field you almost are forced to do it yourself. But it's essential. In a lab you can develop a technology, like the early bone tissue engineering. If we would have done that in a lab, perhaps we could treat 10 patients per year, 20 patients per year. But if you want to have it to have impact, you need to make thousands. And then it needs to be industrialized. So you need to industrialize to reach the right numbers. At the same time, you need to have costs which make it available to the majority of people. And that also means that you need to industrialize it. And frankly, that part is just as complicated as the scientific part. You only get less prestige out of it. So if you are the first to invent something, it gives a lot of prestige as a scientist. If you're able to industrialize it, it doesn't give a lot of prestige. But it does give you the satisfaction to treat patients, and it can also give you commercial rewards, of course. Like Kuros, one of our spin-offs, I think last year treated 40,000 patients, and this year it will be much and much more. So that has serious impact.
So for Kuros Biosciences, this is a company about bone regeneration, and then you have these therapies, and I think it's mostly materials like granules or something that can, it's said on the website that it can actually grow bone even without cells.
Exactly,
and,
it is almost miraculous. It also shows you how long it takes to develop something to clinical application. So I remember, I think this was the late 80s actually of the previous century. Klaas de Groot came back from a trip in China. At that time, Chinese research was hardly existent, and it was a completely different company or country. And he came back and he said, I was in this lab, and they were implanting calcium phosphate ceramics, on which I had written my thesis. And after implantation in skin, where bone would not occur, obviously, they could see tiny spots of bone on the implant. And he was triggered by that, so he was intrigued. And he told me, and I thought, cannot be true. So I was very skeptical. I think they probably put bone morphogenetic protein on it, or they used surgical tools which had been used in bone instrumentation anyway. But we decided that we would ask Joost de Bruin, currently the former chief executive officer of Kuros Biosciences, to repeat that experiment. And then it turned out that it actually worked, but at a clinically irrelevant scale. So we kept on working on it to try to improve it. But then we started Isotus, and Isotus was focused on cell tissue engineering, so expand cells. And we thought materials were only important to support cell growth, but that was all, and give mechanical integrity. But then it turned out that the concept of using adult stem cells in the clinic actually didn't work that well. Those cells would forget what they were made for. And that moved us back to the materials. And in the meantime, we had been improving the materials to stimulate cell growth. And we saw that when we looked at the control experiments without the cells, that we started to create such an amount of bone in ectopic applications, so not in a bony environment, that we thought this is going to be clinically relevant. And then we started the first company on that, and that was Progentics. And Progentics brought it to the clinic, so that product is sold in the US by Globus, one of the big orthopedic companies called Atrex. And we sold that company actually. And then we thought we might even improve upon it, which we did, and that is currently the basis of Kuros Biosciences. But having a material which instructs cell fate is really, really special, and I think still rather unique. There are hardly any clinical technologies that show that.
And also to support such companies that start their journey, you also founded RegMed XB, right? Like consortium, like also a company that helps this new companies, startups to...
Yeah, the concept of RegMed XB was that, and it's a more general subject actually, that what drives, this question, what drives a scientist? Well, of course you have career scientists, they're just driven by the career, but I think in general a scientist is driven by curiosity. And you might even see the pursuit of the truth. We want to know is something true or not, but curiosity is certainly a major driver. For many scientists, this is enough. So that's where it stops. And in our field, that means it doesn't get to the clinic, it doesn't get to the patient. So to take that next step for society is extremely relevant. So we had the concept that you need to start an organization which does that trajectory. And this is something which the Dutch government also wanted at that time. Actually, we had a discussion with the Dutch Department of Economics. And I discussed this concept with them. I said, we should do this as a large scale. So I think we were talking about 200 million or so. You should set available 200 million, and then we are going to take those university projects which have a proven concept, so to say, and then we're going to take it to the clinic. They said, well, it's an interesting idea, so it was apparently exactly the right time, and they also knew me, so they knew it was serious. And they told me, well, look, we are willing to give you 25% if you can get the other 100%. So that was interesting, that was 25% of 200 million. So they more or less informally allocated 50 million. And then we went to our province in Maastricht. We told them, we can do that. If you match it, then we are going to double the funds. So they thought that was a good idea. So they tried to do the best. And then we started to talk with the health foundations, who also found it a good idea. And gradually we grew to that total amount. And it took several technologies to the clinical stage, but not to the final stage. And that has to do with the fact that the Dutch government at a certain moment again stopped with these type of grants. So I think in general you need about 10 years to do that really successfully. And now after 5 years it became complicated again. And that's a pity. So still I think it worked very well. So many researchers have been very application driven because of that. But it could have been even better. But it also shows you the complexity of financing research. Research, of course, is mostly about ideas. But you also need to be able to get the funds for those ideas. And I think our field is particularly strong in these relatively informal discussions with local and national governments. The reason being that when we started our field, we were a non-mature field. So as a biomaterial scientist, I had to compete with stem cell biologists or molecular biologists, and those were established research fields, and they had actually stolen all the research funding. So if you want to go to the Dutch NIH, so to say, the committees were occupied by stem cell biologists, the standards were set by stem cell biologists. There were other fields as well, but and we were just starting, so we would always lose. At a certain moment, I didn't even bother to go to those institutes anymore because I wouldn't get the money anyway. So we were forced to start our companies or to start with, discuss with the government directly. And because of that, we developed skills that others did not have.
And what time was that when stem cell biology was?
Well, actually, it's already the beginning, because I told you we started our first company at the end of the 80s. And we also partially used those early companies to finance our research, so that went hand in hand. So if we would do applications together with the companies, we had a bigger chance to get the money. So we did not use the company money in the university, but the combination of the two allowed us to do that, which allowed us to develop the skills to start a company and to work on application. Now that is a bit more common, but still building these large national consortia is a skill that we developed because of that. So we were forced to do it, whereas other groups didn't have to do it because they could use the conventional means of financing.
But also for RegMed XB, it fosters collaboration between different countries,
Absolutely,
right?
yeah.
Because it's also another part of it.
Yeah, actually that was a collaboration between 4 universities, and that was also very valuable. And I think for the listeners to these podcasts, you should probably realize that research in Holland and the Netherlands is relatively high level, but it lacks the peaks that you have in the US. So yeah, we have peaks at the level of the individual laboratory, but we don't have a Harvard or an MIT in the Netherlands. The consequence of that is that all universities are a bit alike, so they all have more or less the same research profile, which of course is not very efficient, because if everybody doing the same thing, you're also wasting a lot of effort. So that's why we said with these 4 universities we are going to make a choice. So this university is going to do this particular thing, that university is going to do that particular thing. And that was also very appealing to the government, because they realized they would spend the money much better. And that is also easier in this field because we always had to collaborate with each other, because we had to build the research fields. So although we are competitive, we are always very open to collaboration with our colleagues in the Netherlands at least, but also internationally.
And this 4 universities was 3 in the Netherlands, and then 1, I think it was Leuven?
Yes, Leuven, yeah. 4 in the Netherlands and Leuven University.
4 in 1.
Yeah,
Mm-hmm.
yeah. And that's why it says XB, across borders. That was the idea. And that was because Leuven also wanted to do it in this way. And actually we also had the idea that it might be expanded at the European level later on. But then financing got scarce, and then it becomes much more difficult to do that. Yeah.
But do you have any future thoughts on how it will go right now from this point?
Well,
now,
not for me, because I don't think it's for me to do that. I'm currently 67, so it's for the next gen. No, but truly, I find it very important that this is for the next generation to do that. And well, let's see how it goes. If I look at MERLN, yeah, that's going quite well. So in MERLN, I think 4 years ago, I made the decision that I would stop as a scientific director of the institute, thinking about the future, because you see that our lab in Twente is more or less gone. So it's a pity if you leave, you wanted to continue. There's still some activity coming from us in Twente, by the way. But I decided that in Maastricht it would not happen like that. So I decided if I would retire, I wanted to have a prosperous institute here, which could continue. So that was one reason to say, now okay, then I should stop quite a while before my actual retirement age. Because your influence goes down as you get closer to retirement. People know you were going to leave. So it doesn't sound nice, but they will start to listen less to you. I should say, by the way, I was positively surprised by the attitude of Maastricht. So it didn't really happen like that, but I assumed it would go like that. So I thought I should find a successor quite early. And I was in a luxurious position that I had two people who would be excellent candidates. So Pamela and Lorenzo could both do that. Now it became Pamela, but yeah, Pamela was so good that she became provost of our university now. But that was good for Lorenzo, so that gave Lorenzo the possibility to show his skills. And we had 150 people, and if you look at the amount of ERC grants, so the most prestigious European grants that we get, I think it's about half of Maastricht University. Also the Veni Vidi Vici grants, the personal grants, we're very successful. Large collaborative grants, with the Gravity grants or the Summit grants, we also score all of those. So I think it was a good decision to have somebody else take over.
So you said that, so you left the scientific director position, and then Pamela Gepipovich was, then Lorenzo Moroni, but you are still advisor and principal investigator here. So
I'm a university professor, so I have the responsibility to help to build the infrastructure, so to say, for this field. So it's still, now my personal scientific hobby is still the synthetic embryos. I like that. I like the other research as well. I'm still very interested in osteoinduction, so triggering bone formation and in non-bony sites. I find the synthetic embryo spectacular because it also has the potential to change society, and it makes it very. I'm not allowed. My daughter is in science. My oldest daughter. She does not allow me to use the word cool as a motivation, but I find it very cool reason, so I don't listen, as you say. I find it, so I still like very much to be associated with that. And currently I'm also helping out with the federalization, as we call it in the Netherlands, so building businesses out of research at this university, which frankly I think is not done in an optimal way, so that should change. So I try to help out the university board in that. And I'm helping out with new spin-offs, with Vitalix, for instance, and Regen, which we have on the campus here. So that keeps me partially active. And then I'm still chairman of the board of Kuros, of course. I did stop with my real investment work. We cannot discuss that. I also started 2 investment funds with some other people. And that's what I actually stopped with in July last year.
Mm-hmm. And how do you help now the spin-offs, new companies from universities?
Partially making people realize that it might be a good time to start a spin-off, helping people to apply for patents at the right moment. I also still help a bit by recognizing how you can make a high impact publication, which is quite important in our field. I think I can also still be helping out in only doing the special stuff. So for me that's quite easy because I easily get bored by the non-special stuff, so I automatically focus on the special stuff. But then I think I can also help people to recognize that something is special or not and worthwhile to pursue. So I think that keeps me busy still a bit. Yeah.
So you said that you can tell teams that it's the right time, like research groups for example, that it's the right time to make a company out of it.
Yeah.
But how do you know? Are there any like qualities or something that you say, okay, this is the right time where you can go?
It depends on the moment in time. So this changes depending on the period. So, for instance, up to a year ago, if you want to raise something, get real finance for it, you need to be selling actually. So you need to be in the market. So for a university spin-off, that is not easy. The good thing is that there are in the Netherlands quite a lot of relatively small funds. So that allows you to raise a couple of millions to start a venture. That's what we are currently doing. I don't think we're doing it enough. I think we could do much more. But at least we are starting again. And if you start relatively small, the good thing is you can still combine it with regular research financing. So that gives you a couple of years to make it more mature, and then you're ready for the big investments. So that's what we now, so we did that several times in the past, and we should do it again. So we're now working on Vitelix, a spin-off on the synthetic human embryos. Yeah, now here, I think it's totally obvious that at the moment that you're able to make something, which apart from the ethical issues, which are also important, but you're able to make something which looks a lot like the early human development, then it's totally obvious that there's also a market for it. And there's a need for it, and there's a market for it. So I would strongly advise this university to build a very strong patent platform based on our technology, because we are one of the first movers in that field.
I think it was even published in Nature, this article.
Yeah, it took a long time. Well, frankly, it also shows you how sometimes difficult that can be. Because this was something which we first saw in Twente. It was coincidental findings. So we were very much interested in cellular self-assembly, self-organization. So how do cells find the right spot? How do they interact in 3 dimensions? And Roman Trunkenmüller had in our lab had developed these high throughput plates to do that. So we were doing all types of experiments to see on how we could play with the 3-dimensional configuration of cellular aggregates. And we thought that the cell surface characteristics, so the physical cell surface characteristics, would be very important. And then we saw that in the early embryo you would have these 2 different cell types that have these different properties. So we thought, well, let's see if we can put that in there and see what happens. Not thinking at all that we would make something which would look like the early embryo. And because it was high throughput, we saw that 1 in 1,000 would start to show these cavitated structures, which are indicated for the early blastoid, so the early embryo. So if we did not do high throughput at that moment, we would never have seen it, because then you would need to repeat an experiment 100 times to see it 1 time. So you would just say, it's coincidence, I don't look at it. But now, by repeating the experiment, we would see it again, 1 in 1,000 or so, but we could do 10,000, so we would have 10. And then we could start to optimize. So already after a year, we knew what we had was something which looked fair. It was the mouse, by the way, at the time. Mm-hmm. That we had made something which was very similar to the early mouse embryo. But we were technologists, engineers. If you want to publish that, you are going to be reviewed by the stem cell biologists, on which we discussed earlier in this talk. So they didn't want to publish. So it took us 5 years to do all the experiments that they wanted us to do to get this published. So now we don't focus on Nature that much anymore. So we're much more into Advanced Materials, which is also top journal, I think 35 impact factor or so. But that allows us to publish fast, be assessed more by our colleagues, engineers, and that type of scientists. Beautiful research line.
Such interesting that many innovations were made just by coincidence.
Yeah, they call it serendipity. I had a discussion with my partner at the investment fund actually 2 weeks ago. We were discussing what is good science and what's not good science. And he said the absolute top category is those scientists that invent something out of nothing. He said that's not you. So, and I think that's true. Yeah. So, and then he said that then you have this small group of people that are able to associate and to see the connections in a very early stage. And he thought that was me, which I think is a compliment, and I don't totally disagree with it. So, I think it's a talent to see when something is special. That was that moment. So I think so here it was not only me, it was also Nicolas Rivon at that early stage. Erik was also, Vrij was also associated with it, and later also Roman and Stefan. But I think it is talent to see that this might really change the scientific field. I think that is a relatively rare talent. Yeah.
Do you think it's possible to develop this?
Yes, well, up to some degree. Yeah. I know from Pamela, for instance, who by the way was very, very good or excellent. You know, in Holland we say very good, that is the optimum, but in the States it should be excellent, of course. But she was a very good researcher already, but I always pushed her on creativity. Okay, this is all very nice, but now do something which nobody has done before. And she told me that took her a while to acquire that skill, which shows that obviously she could already do it, but she was able to build on it. And she also found it difficult. And talking about scientists, I'm not. There's this anecdote in the Netherlands of, I don't know the first name, but it was one of the founders of Philips. So you had the Philips family. At that time it was huge. I think 300,000 people working for Philips worldwide. Huge inventions they made. A research lab which was better than most universities. Frits Philips it was called. And Frits Philips said, I have this problem with ideas. And that meant that he had too many of them. So he had ideas all the time. And I recognized that. So I especially when I think about it, I can have an idea a day or so. And then I used to be stopped by my staff at a certain moment because I have the idea and I throw it over my head and somebody else has to pick it up, of course, because you can only do so much. So every now and again they would tell me, you can stop. No more ideas anymore. Let's first finish these ones, which is probably wise. Yeah. But I think that is also those decisions probably decide the scientific career, when you decide to invest in it or stop it. Stopping is also very important.
Yeah, especially if you're very creative, right? Everything is round and then you have to...
I compare it a bit by if you want to grow a beautiful tree, you need to trim the tree. So you need to be able to decide, okay, this is not interesting anymore, or that's going nowhere. I think that a good scientist should be able to make that decision. A little bit like art also, by the way. What makes and you're a dancer, what makes a movement more beautiful, or what doesn't make a movement beautiful? In science, I think it's a bit the same. I think it's also interesting, because if you go to a conference, you hear a presentation, and what are the terms that people use? How would you describe it? You hear this presentation which appeals to you. How would you describe it? What type of terms you would use?
Maybe something with curiosity or interesting for me.
No, I'm thinking more like what I use, and what you use, I'm sure as well, is beautiful, brilliant, exciting. Those are all artistic terms. That's how if I judge the work of my colleagues, I don't say, oh yeah, that was published in Nature, or he has an impact of such and such. I will describe it in terms of special, or beautiful, or boring. I think that's how you look at science. So I think that characterizes science very, very much. And that I think also makes it appealing. The difference is, of course, that science is very rational. So in the end, it needs to be logical. You need to prove your ideas, which takes a lot of effort. But it has a lot in parallel with arts, I think.
And if we now a bit step out of it and look back at your quite inspiring career, what would be the moment or the project in your career that you're most proud of?
There's several. So if I look at the research which we have done on osteoinduction, which is still a research line here and in the company as well, I think that has had most impact. So in that sense, I'm very proud of it. The first thing which I think because we made it up ourselves, is the early bone tissue engineering. We were very early, so there was a group in Japan doing something in the field, there was the group of Bob Langer doing in the field, and there was us. We were the only ones doing real bone tissue engineering in the sense that we did not only use cells, but also made the matrix and implanted it, so that was unique. So I think that's where we also had a tremendous impact, really the start of the field. Another aspect which we did not discuss was the metabolomics work which we have done. Actually, in our group, every 5 years we would sit down and decide if we're still on the right track. Are we doing the right stuff or not? I think it was somewhere in early 2000 that we realized that the concept in tissue engineering, so using living cells for tissue regeneration, was that you would trigger cells into a specific fate to make kidneys or bone or cartilage, and then you would implant those cells and they would start to make the tissue that you wanted. And the idea was that the better you would understand the differentiation of those cells, the better the result would be. And first of all, I did not believe in that because it was not working, that concept. Second of all, I thought it could take a tremendous amount of time to really unravel all the mechanisms behind the differentiation of those cells. So I thought if you were going to do it like that, it might take 2 decades. So, and it was mostly a discussion which I had with Jan de Boer at that stage, and we said we should not pursue this route, we should stop. Instead, we should use high throughput research, so we should just start to search for things that work. So forget the understanding, just go on a discovery, but high throughput. So, because what would typically happen is, in normal research, you would say, okay, I have this now, it doesn't work, I need to improve upon it. So I take 3 variations, and I start to test 3 variations. First, I do that in a culture dish, in the lab. If I find something that works, I will do it in an animal, and then if it works, I'll do it in a human. That entire trajectory takes about 10 years, and if it doesn't work, you have lost 10 years. And that was what everybody was doing. And it was going wrong. So we decided, no, you shouldn't do it. Your initial search should be much smarter. So you shouldn't look at 3 things or 10 things. You should look at millions of things. And then take the best 10 out of those million, and then go through that direction. Ideally, also do high throughput in the animals, so that you are able to do this screening much, much faster. That meant that you need to accept that the fundamental scientific approach of first understanding and then applying, you could not use. So that's what we decided upon. We are going to abandon that trajectory, and we're going to go up high throughput in material science. So then we started to design material surfaces, which had never been done before, more or less at random. And we built a library of, I think, 20 million different surface structures. And then we made a culture plate which allowed us to make a selection of about 2,000 of those surfaces. And then in specific biological assays, test how cells would respond to that. And actually that works. So we were able to show that what we found, we were able to find special things. The technology worked, and we also showed it worked in animals. Today it still has not been applied in the clinic, because that has more or less stopped actually that development. But I'm still very proud of that, because perhaps here by the way, we did invent something out of nothing. So we really thought, what's there doesn't work, what do we need to do? And it was about a 5-year trajectory. So from the initial concept to that. And then the latest addition is the synthetic embryos. But that was also something which started from the idea that we wanted to use self-organization. So it had a little bit to do with what I just discussed. We thought, you do not need to understand everything. You asked, how do you guide a lab? And I think self-organization looks a bit like that. So you cannot direct everybody's brain completely in a group. That's impossible. So your supervisor will give you some instructions and you will do the job. And you will add to that. With cells, it's the same thing. They have a large capacity to do it themselves. So that's why we thought you don't need to understand it all. Let's try to investigate how we can have them do their own job. And that's what made the synthetic embryo research develop. So you started with a question some time ago on, is it coincidence? Up to some extent, the early start of the osteoinduction is a coincidence. Finding the first thing that looks like a synthetic embryo is a coincidence, but it comes from a field that you have sought yourself, where you have thought about a concept, which at that time was really different from what most people were doing, because there were only very few groups working on self-organization. And I think there were no groups working on high throughput research in materials.
So it also matters on how you look at things. You can just look from the other angle and then you see maybe some different
I think you need to be open to, I'm not so sure. I think you can have a beautiful scientific career diving very deep into a single subject. I think that can also be great for people. I think it also depends on how you are built. I know, for instance, I function best at projects which take about 5 years. So if it's longer than 5 years, I can still do it, but it starts to take more and more energy. So that's why I almost automatically start something new every 5 years or so. If you look at my career, you don't see that, because it's all based on the same type of knowledge, more or less. So it looks like a continuous line. But in reality, it's project and project. Now, other people are much more suited for diving deep during a very long time. So I think there are many different ways to have a satisfying scientific career.
Wow. Actually, we're in time, and I really don't want to finish this discussion because I think there's so much more that you can tell. But actually, the last question that I have for you today, I think it may be surprising for you, but what would you do if not regenerative medicine?
It could be anything. Yeah, really. I think if I look at, I ended up in regenerative medicine, a beautiful field. But if I had made that early decision to start building bridges or buildings, I'm sure I would have found it very appealing as well. So I think for my career, it could have been anything, provided that that at least I would have the idea that it would be novel. Of course, other people might not share that idea, but I think I'm quite holistic in that. Yeah.
Thank you very much for your time, and I would also like to invite my team to come here, and also thanks to them we are able to make this podcast, to make these episodes, to invite such inspiring people. Thank you very much. Thank you guys, Nika Cindori, Albovia Grasso-Martin, Michiel Bagirov, Alisa Avsyanikova, and Professor Clemens van Blitterswijk.
A pleasure. Thank you very much for the invite.
Thank you very much for listening. We hope you enjoyed this episode of Biomed Unleashed podcast and will stay with us for the next ones.